have over 880 individuals registered to view the webcast live today, and I'd like to welcome the public to the meeting. We have all 14 members of the advisory committee here today. I have their names listed up on the slide that folks can see. For the public, if you're not familiar with all of the advisory committee members, you can go to our website, dietaryguidelines.gov, and click on meeting number 1, and there's a short bio sketch on each of the 14 members of the Dietary Guidelines Advisory Committee. In addition to the advisory committee members around the table, I just want to introduce a few folks. Undersecretary Concannon from Department of Agriculture. He's the Undersecretary for Food, Nutrition, and Consumer Services. Don Wright, who's my boss, who's the HHS Deputy Assistant Secretary for Health, for Disease Prevention and Health Promotion. In addition, we have Jackie Haven. Jackie's the Deputy Director and Acting Executive Director for the Center for Nutrition Policy and Promotion at
What's going on?
We could consider them effectiveness.
Public meeting after the committee is disbanded to give oral testimony on the committee's report, and our two departments will use that information to then develop the dietary guidelines for Americans. The policy document, Dietary Guidelines for Americans, we hope to have out by the end of 2015. So the committee's work will be done at the end of 2014, and the policy document will come out in 2015. The committee plans to have 3 more public meetings this calendar year to discuss its recommendations and finalize what it wants to put into their report. We plan to announce those 3 dates within the next month or 2 on our website, dietaryguidelines.gov. So if the public wants to check in a month or 6 weeks, something like that, we'll have all 3 of the future meeting dates of the committee posted on our website. We do have the presentations from the January meeting now posted on our website. I want to apologize that it's taken so long to get the presentations from the January meeting up. We're working hard to shorten that process, but we are required to meet 508 law for anything that we post on our website, and for complex slide presentations that takes quite some time. But the link to the webcast, archive webcast from today, will be on the website sometime next week, and hopefully within about 3 weeks we'll have all the slide presentations, both from the 4 expert speakers as well as the 5 subcommittee reports from today and Barbara Millen's talk this afternoon. So without further ado, I'd like to ask Mary Story, one of our committee members, to come forward and to introduce our first speaker. Mary?
Thank you. I'm pleased to introduce Dr. William Dietz, who is one of the most internationally esteemed obesity experts, researcher, and scholars in the field, and who is a household name in the obesity area. He is a pediatrician and has his PhD in nutritional biochemistry from MIT. He is currently a senior advisor to the Robert Wood Johnson Foundation and a consultant to the Institute of Medicine. Before that, from 1997 to 2012, he was the director of the Division of Nutrition, Physical and Activity and Obesity in the Center for Chronic Disease Prevention and Health Promotion at the CDC. Before he went to CDC, he was a professor of pediatrics at the Tufts University School of Medicine and Director of Clinical Nutrition at the Floating Hospital of New England Medical Center Hospitals. He also served on the 1995 Dietary Guidelines Advisory Committee. He has been actively involved in many professional associations. He's been a counselor and past president of the American Society for Clinical Nutrition and past president of the North American Association for the Study of Obesity. He's received far too many awards for me to even mention now, but we're very pleased to have him come today and to present to the committee his thoughts on effective prevention of obesity in health settings, barriers, and opportunities. Welcome.
Okay, great. Thank you. Mary, thanks for that introduction. I need to amend her opening comments. I think I'm a household name only in where I live and in the houses of my children, but I think that's really over the top. I'm also really pleased to be able to address this committee. The 1995 committee was a much less regimented process. I mean, I think, as I recall, we had maybe 4 staff, and now I understand there are about 50. And we had 2 from HHS and 2 from USDA. And we certainly weren't engaged in the kind of systematic reviews that you've been immersed in. But it's also a pleasure to be here among so many friends who I've known for so long. Notice that I'm not using the term old friends because I think the ambiguity of that is something I'd like to avoid. I've been asked to talk about the effective prevention of obesity in healthcare settings and barriers and opportunities, and I'm going to try to draw some parallels with the challenges that we face in obesity prevention and control with the challenges that you face in terms of the dissemination of the dietary guidelines. I think that as I've seen the dietary guidelines emerge over the last 20 years, it really is clear that the modifications to the guidelines are pretty minimal or minor, although, you know, as a committee you think they're so earth-shaking and theme-changing. But the point I'd like to make is that this is not so much about what those guidelines are about, but rather about how we disseminate them, how we implement them, and that's been a challenge since the beginning. So I think if we think in terms of the social ecological model, that the medical settings are likely to have the smallest impact in terms of both obesity prevention and control, as well as the implementation of the guidelines. Most of the work to date on obesity has been at these outer levels, at the federal, state, community, and institutional levels. We know relatively little, I think, or compared to what we know about policy in those arenas, relatively little about the ways to effectively deliver care for obesity. The other point here is that these circles really need to be porous, and to date they have not been as porous as they should be, so that there's this kind of cross-translation of what's happening at the community level being reinforced and by what the messages are and strategies are elsewhere. It's also important to mention the difference between the prevention of obesity and that for the treatment of obesity. There's a nice paper that may or may not have been in the papers that you've reviewed by Claire Wang, published in the American Journal of Preventive Medicine in 2012, in which she modeled the caloric deficit necessary to return the mean BMI of children back to where it was in the 1970s by 2020. So this is the daily per capita deficit. For 2 to 5-year-olds, that's 30 calories a day. For 6 to 11-year-olds, it's 150. For 12 to 19-year-olds, it's about 180. And in a paper that Kevin Hall published for adults, it's about 220 calories. And those, in my view, are caloric deficits that can be readily achieved by policy and environmental modifications. but they're not going to really affect the severity of people with severe obesity for whom those caloric deficits to get them back to a healthy weight are quite substantial and beyond the reach of any of the policy and environmental changes that we are implementing so broadly across the country. Now, the other point is that currently the treatment of obesity is not aligned very well with the severity of obesity and its costs. These are data that I calculated from this paper from Arterburn. And notice that about only 8% of the population have a BMI above 35, grade 2 obesity. These are self-reported data rather than measured data, so they're underestimates of obesity. But notice that that 8% of the population generates 40% of the costs of obesity. And these patients are deservedly the focus of the intensive interventions that were recommended by the report released in the fall from the Heart Association and the Obesity Society. And these are the recommendations for the treatment of severe obesity, with a goal of 5 to 10% weight loss within 6 months. That's a weight loss sufficient to reduce the comorbidities associated with obesity. And an intensive lifestyle intervention is defined as at least 14 visits within a 6-month period, with a caloric deficit of 500 calories per day. You can see here the caloric levels of intake for women and men, and a recommendation of implementation of the physical activity guidelines of 150 minutes per week. And these guidelines, as you know, don't necessarily mandate continuous physical activity, but at least 10-minute increments, and the implementation of these strategies by behavioral modification.